here, and I've got Alyssa and Aiden, and we are going to start. This is for Dr. Bednar's recovery patients. I'm my doctorate in physical therapy, and I've been teaching fitness classes for longer than I'd like to admit. But I'm going to start. Today's my 4 weeks post-op, and we're allowed to do abs and legs. So I'm going to go through a little bit of exercises, and my kids are homeschooling because of COVID-19, so they're going to join me for PE. I'm actually going to go ahead and take this off so you guys can see my posture and my alignment. So we're going to start with rolling the shoulders back, really drawing the shoulders back so you're engaging and bringing the shoulder blades together behind, standing nice and tall. And then you're going to just place your hands on your belly, and you're going to take a deep breath in and see how the stomach expands, fills with air, the chest expands. And then you're going to exhale, draw the belly in, lift the rib cage up, exhale, and breathe out. So we're going to do that a few times. Deep breath in, exhale, pull it in. Deep breath in, exhale, pull the belly in. Now I want you to hold the belly in, but continue to breathe. So we're engaged, we're tall, we're lengthened. Place your hands on your hips. So these are actually your hips. This is the top of your pelvis, your waist. These are your ribs. So kind of fill those points. Waist, pelvis, hips, pelvis, waist, rib cage. So what I want you to do is place it right on your pelvis at the waist, and I want you to shift, separating the ribs from the pelvis. Pulling the belly in, keeping lifted up, you're going to shift. Long deep breaths, exhale. Keep drawing the belly button in tight and shift, shift. Good. Feel how you're isolating, kind of moving that low back. Good. Now, again, rib cage, the abdominal muscles insert into the pubic bone. And when you're laying on the ground and you do a curl up, you would be crunching like this. So we're going to kind of stand and crunch. You're going to pull the belly in, exhale, and then crunch and release. And feel the pelvis lengthen, and then let it extend. Let the stomach lengthen and the back kind of arch. So you're moving the core, moving the pelvis. So this is for range of motion and strength. And if you really squeeze that belly in, you can feel those muscles, deep abdominal muscles engaging. Keep breathing. So keep that up and go 7, 6. Use that breath, really pull it in tight like someone could punch you in the stomach and it's nice and solid. 3, 2, 1. Good. So now you're going to shift the hips and you're going to lift. So we're doing this, keeping the belly in, we're shifting, shift, and then pretend there's a rope and you're lifting the hip up and the ribs come down and then you release. So it's shift, lift, down, shift. So we're going to keep it all on the right. So shift and then little side bend, squeeze like that. And then use that breath, exhale as you draw the belly in. So here we go. 7, 6, 5. So really isolating that core. 4, 3, 2, and 1. Now we're going to go other side. Don't worry if you don't get it. If you're struggling to isolate, it takes a lot of control. Just keep engaging and tightening that stomach and just do the best you can. So again, we're going to side bend, shift, and then kind of lift and squeeze right there. Here we go. Shift. Really squeeze. Here we go. 6. How you doing back there, Aiden?
Good.
5.
You can't see Elizabeth.
I know. 4. You could scoot to the right if you want to listen. 3, 2, 1. Good. So I want you to keep the shoulders back, keep engaged. And then we're going to do a little bit of warm up for the legs. I'm going to stand backwards a little bit. So we're just going to squeeze, like just a hamstring curl, right? So it looks like this. You're just going to kick, kick. Yep, that's it. So shoulders back, keep long, abs in, keep engaged. Feel the hamstring, so it's nice and easy, but you're squeezing at the top. Squeeze. So engage, tighten. Good. We should have some music, eh?
Yeah.
6, 5, 4, 3, 2, 1. Good. So shoulders back, abs in, hips shoulder width apart. And now I just want you to lift the knees. And as you come up, pull and kind of pelvic tilt. Squeeze the belly. Go up. Squeeze. 7. So really squeeze, engage. 4, 3, 2, 1. Now you're going to kick. And just do the best you can here. Just kick. Kind of lean back. Feel the upper abs engage. And kick. Really lead with the heel. Kick. Your flexibility, right? If you can't get the leg up that high, you can kick low or high. 4, 3, 2, 1. Good. So recheck your posture. Shoulders back. Belly in nice and long. I want you to balance on just one leg and do little lifts. Now imagine, squeeze. Pretend that you're pulling a rope up and then you're pressing down. So make it tight. Squeeze. Press. Feel the pelvic muscles, the inner thighs contract as you press down. Use that breath. And again, you can pause if you need a little break in between. If you feel that your heart rate's getting too high, you can take breaks. 3, 2, 1, and then other side. Get that balance, shoulders back, abs in, engage. Flatten that foot on the ground and lift, press, squeeze. Keep pulling those abs in. So you can either hold here, you can balance, whatever works for you. Squeeze, squeeze, press, tighten, squeeze here. Do one more set. 6, 5, 4, 3, 2, and 1. Good job. So just kind of march it out a little bit. I'm going to move back so you can see we're going to do some squats. Shoulders are back. Again, actually I'm going to come up for the alignment. Shoulders are back. Feet are shoulder width apart. Feet are flat on the ground. And you're going to press that bottom back. So I want you to start by just pressing the bottom back like this. And then as that bottom's back, you're going to sit back. So I'm going to show you here, you don't want the knees over the toes. So it looks like this. Sitting back. And then press up, press, press. So it's not this. You're not just bending the knees. You're sitting back and then you're pressing up. So if you're new to it, just start small. If you have the strength and flexibility, you can go farther back or even all the way back and down. So let's give it 10 more. Keep squatting. Good form, good posture. Press back, push up, squeeze, press, engage. Use that breath. Exhale, draw it in. 2, 1, good. We're gonna do a couple more exercises. You're going to do lunges now. So you're gonna step back nice and wide, knees and toes forward, and then you're just gonna drop straight down. So, again, knee stays behind the toe. We're not lunging forward. We're going straight up and down. Up and down. So get into position. Again, if you're new, you could, to these exercises, you can start really slow. I don't mean slow, well slow, yes, but also short. So the deeper you go, the harder it is. 12, keep the shoulders back, abs in. Again, if you need to take breaks, take breaks. And then we're gonna switch sides. Again, nice and long stance. Get that body back. You're going straight down and up. Again, I'm gonna show you what the posture looks like. The knees, you come down and go straight up. Common mistake, you wanna lunge forward. So we're coming down and up. Keep it going, good. Take a break if you need. If you're starting to breathe too fast for the post-op, pause, give it a few seconds, minute, come back. Okay, almost there. Three, 2, and 1. Good. Now, if you want to find something to hold on to, you're going to keep engaged. So you can see the difference. Here I'm not engaged, now I'm engaged. And we're going to just lift and press. Squeeze, press. If you want to challenge your balance in your core, then you don't hold on and just lift. So that's up to you. And then switch sides. Again, leg comes out, shoulders back, abs in, keep that posture and lift. Try to keep the toe down, go nice and straight. Squeeze and press. Keep that belly engaged, shoulders back. Working that core. 4, 3, 2, 1. Good job. So, I'm trying to keep this at 15 minutes. 2 minutes, we're going to do a little bit of stretching. So if you have a chair or a couch or a table or anything, have you take it, put your foot up on it, keep those hips forward, and then just start to lean forward. So you feel the stretch behind the leg. Good. So you see my daughter there. Can you bring your toes up, Alyssa? Yeah. And then hips straight, just lean forward. That's it. Good. And then switch sides. Heel out, toes up. Nice and long, hips forward and stretch. Make sure you don't press on the knee. You can go above the knee or just kind of hold the hips below the knee, whatever your flexibility is. And don't worry about if you're not going far. So I haven't been doing much this last month and I'm limited. I can already feel that pull in my hamstring and my calf. And release. Again, you can always use chairs. I didn't say this earlier, but for balance. So we're gonna grab the back of our foot. If you're having trouble with that, you can use a band or something, or you can use the chair itself. You can put the foot up on the chair, and then you can kind of lean back until you feel the stretch in that hamstring. Again, trying to keep quadricep, the front of the thigh. Trying to keep those hips straight, and you're gonna lean back. Long, deep breaths. Again, if you have more flexibility, that you see like Alyssa's got there, can reach for that foot, take some balance. And then let's switch sides. And release. Okay, we're gonna stop the video here. I'm gonna do some more stuff for the floor and some other activities, but this is our first video. Thanks guys, good job.